Mr. Speaker, eating disorders are among the most distressing conditions for young people and for families. Even though psychological services are very useful and effective for helping children with eating disorders, long wait lists for psychological outpatient services persist in Manitoba. Why has the NDP paid so little attention to psychological services for our children that wait times are so long for these urgently needed services?
I thank the member for a question on a subject that's close to many people in this legislature. We know that eating disorders are among many of the psychological stresses that young people face these days. There is a special clinic that deals with that has been put in place through support from this government. The members opposite voted against it, and quite frankly, the member from River Heights voted against those budgets as well when we put those resources in place. So we do believe that there has to be support. We do believe that there has to be support for young people going through this, and that includes psychological support. And the members opposite that protest that need to actually align their voting record with what they ask for. They consistently vote for cutbacks in services, they demand cutbacks in services, and then they advocate for more services. We have actually continued to support services during difficult times while we've created good jobs, but psychological services are important, particularly for young people in Manitoba, Mr. Speaker.
Mr. Speaker, the Premier talks about the importance of this psychological services for people with eating disorders, children. But most parents and families simply can't afford the only alternative of paying for private psychologist treatment for a child with an eating disorder. And they are left to wait and watch as they're too often their loved ones suffer, physically weakens and withers under this oppressive condition. Manitoba Liberals will end this two-tier system that still fails to see mental health as part of health care by providing coverage for these psychological services under Medicare. What is the Premier offering these parents who have to wait and watch their children suffer?
Mr. Speaker, I again remind the member from River Heights, he was part of the federal government that downloaded 37% cuts to health and social services all across this country, Mr. Speaker, and the provinces have been working for over a decade to put that right, Mr. Speaker. In 2009, we put forward a special service to deal with eating disorders, a prevention option, as well as a community treatment option through the Women's Health Clinic, and over 271 people have benefited from that. We have additional money that we put in the 12-13 budget, and we also have identified 19 people that will begin the program in the next 2 months, Mr. Speaker. It is important that we have support, both in-hospital support and out-hospital support, so there's support in the community as well. And I note again that this budget, this very budget that we still haven't finalized the Budget Implementation Act on, which has been stalled by all the members opposite, has a $2 million program to expand mental health services in Manitoba. And those $2 million for mental health services are something we've never heard a word on from the members opposite, and we know they will vote against it, Mr. Speaker.
Mr. Speaker, the NDP's 16-year-long piecemeal approach has failed to meet the needs of a very serious problem.
Exactly.
The Child and Adolescent Eating Disorders Service can accommodate only 6 participants at a time in day treatment, and their current wait time is up to 6 months.
Oh, that's handy.
Eating disorders can be life-threatening.
Absolutely.
Parents desperate to access psychological treatment for their suffering child are very aware of this fact. Why have the NDP failed to enhance access to life-saving psychological services for children, as Manitoba Liberals will do?
Again, Mr. Speaker, we put the resources in place in 2009. We've expanded those resources since. And those resources are both in-hospital, they are both in-hospitals patient services, and they are both, as well as outpatient services in the community, Mr. Speaker. And we know this is a serious issue for many young people, which is why we do prevention programming as well, Mr. Speaker, to help people be comfortable with who they are. The members opposite have voted against anti-bullying legislation. One of the reasons young people have psychological disorders with respect to body image issues and eating disorders is because of bullying. And what do the members opposite do? When we put a program in place to deal with anti-bullying, they vote against it. That's their approach. They leave people out. We find a way for helping people to belong, regardless of who they are, regardless of the issues they are dealing with. We want them all to have a great sense of belonging in Manitoba, and if we have to provide psychological services to do that, we will do that, both within the community and in the hospitals as well.